Hey there, let's talk about pathologies. And these are patho means disease. So we're going to look at the study of diseases in the integumentary system. To describe the symptoms and qualities of different diseases, we need to construct very specific medical terms. And we're going to start some baby steps in that construction. So our goal here in purple is to combine your unit roots with specific suffixes to create medical terms to describe changes in color, texture, or condition of skin. Now, you should be able to mix and match suffixes and roots from your entire list to describe skin conditions. So this will just be an intro to how to, and we'll use a couple subsets of terms, but I want you to work on expanding that list as we go further. Okay. So we'll look at xantho. Xantho starts with an X, but it has a soft Z sound. So xantho means yellow. And I could look at a skin condition or a person and say that they have kind of yellowish skin. And I would never write just xantho because that's not a full word, but I might use the term xanthoderma. Derma is one of our suffixes, and that means skin. So this literally translates into skin that appears yellow. So if I say that your skin appears yellow, it could be that you just have like yellow makeup on, or it might be that you have a yellow undertone, or it might be that it's something abnormal that I'm concerned about. So I can be more specific. I can come up with a term that actually means abnormal skin condition of yellowness. So I could use the suffix of osis, which we know means abnormal condition. And if I combined this with xantho, I'd have a xanthosis. And that might describe something that I know is abnormal. I might not know why yet. I might need to do some tests, but I could say, yeah, you look abnormally yellow. One medical condition that does lead to abnormal yellowness is jaundice. And jaundice is a byproduct of liver failure or liver disease. And so advanced liver failure releases bilirubin into the bloodstream, which can build up in the fat tissue and the capillaries and create kind of a yellow cast to your skin. So that would be a xanthosis that we would be worried about. Another root that we need to look at and explore is cyano. And cyano is a big indicator of poor oxygenation. So if we see somebody who's looking blue, that's not a good sign. So cyano means blue. Cyano gets its name from cyan color or cyan pigment, which is a blue pigment. And if you see it in a person, it's probably because they either have poor oxygen levels in their blood, and so their blood appears darker in color, and so they look not as pink and flush, but they look a little bit blue to pale grayish in color. Another place that we'll see cyanosis or abnormal blue coloration might be just at the extremities, at the fingertips, the toe tips, the tips of the ears, the tips of the nose, and we see this a lot in people who have cold exposure. And we see this in animals as well. So we tend to withdraw heat to the body core and we sacrifice the extremities. And we do that through vasoconstriction, right? We block off blood flow to those areas and they become blue in color. And then eventually they can even die from a lack of nutrient source. And we could also see overall blueness in color if, for example, you were to stop breathing, your heart were to stop, or your heart were working very, very poorly. So if we see cyanoderma, blue skin, or cyanosis, we should be very concerned. Cyanoderma would just simply mean blue skin color, right? And that could, again, be that I just painted myself up like a Smurf. Or it could be that I'm starting to turn bluish in cast because I've been out in the cold and I'm looking a little pale. But if it's persisted, I would call this cyanosis, or I might talk about you as being cyanotic. So that's just another ending to conjugate. Another common term in pathology of skin is edema, and that means basic swelling or puffiness. Note that edema does not mean redness per se. It's really talking about texture. It's talking about the fact that there's this pitting. When I press into your skin, it makes this squishy, and then there's like a pit that forms. So pitted edema means that you're stocking up fluid within the tissues and usually within the dermis, right? The dermis is filling with clear fluid. So there's no indication of pus or infection necessarily, but we do see puffiness, and we call that edema. Erythro is another common color term that we're going to use. It's one of the big signs of inflammation, and so we see it a lot in skin conditions. So we'll see redness, and I'll have you pause your video and see if you can come up with maybe 2 or 3 terms that you could come up with using the root erythro to describe like a reddening skin. No, really do it. Okay, so you probably came up with something like erythroderma, right? Erythroderma would be just general redness of skin. Erythrosis would be saying that's abnormal, that you have this red patch here. And in skincare, we tend to use this term that means like you have a generic red rash and we don't know what it's from, and we call that erythema. So it's kind of a shorthand for erythroderma. We just call it eryth, and we cut out the derm and we just say ma. So know this term as well. Erythema is a way of talking about generic red skin condition. Okay, now yet another condition that we might want to look at is like, let's look at the trifecta. So there is a skin disease called psoriasis. It's quite common, and it has dryness, redness, and itchiness or scaliness as a symptom. So we've got these scaly white puffs, we've got these red underlying kind of swollen areas, and it's very itchy for people. And so this particular autoimmune disease, we might use roots like xero, which means dry, ichthyo, which means scaly and itchy, and erythro, which means red, to come up with terms to describe this condition. So we would need to come up with a suffix for each of these terms, and then we would be able to come up with a list of medical terms to describe psoriasis. So go ahead and try that. Here we have a specific example of xero. So xero, again, using that Z sound, means dry. And it could just be, I'm talking about, oh, that wound is dry. And so that's not abnormal. That's just like, it's xerodermic, right? It's xerotic, okay? I might be able to say that this little patch here is abnormally drier than the rest of the skin. And so I might say that this is a xerosis or a xerotic condition. I might also be describing normal changes in skin. So elderly people experience xeroderma because they produce less sebum as they get older from their sebaceous glands. And so they have to use more lotion. I don't know if you've ever noticed, but my elders used to have like lotion in like every room of the house for some reason. This is probably why. Another term that we're going to need to use is to describe this condition here, this black skin, and this is necrosis. So necrosis is an abnormal death of tissue, right? And anytime you see dead tissue on a living body, that is abnormal, so we're just going to call it what it is. It's necrosis. And it has the root necro, which means dead. Necroderma might be adequately used to describe like the upper portions of skin that we exfoliate, but really we're going to reserve necro for like real chunks of dead tissue that we probably need to remove. One way that we can get necrosis that people know of is gangrene, and I mentioned this in the cyanosis slide. Gangrene forms from a lack of blood supply. So if you are out in that cold for too long, that continuous restriction of blood supply deprives your skin or your extremities of oxygen and nutrients. And so you're starving it of all of its essentials. And so it essentially dies over time. And once you have something that's dead, you just can't bring it back by returning blood flow. You just can't. So that means that we need to remove that dead tissue in order to keep that decay from spreading into your healthy tissue, in essence. So if I left these dying toes here on this body, biology would happen, and we would have bacterial and fungal breakdown of this dead tissue. We'd have decomposition, and those decomposers would just continue to eat on the sick and like dwindling, dying tissue that is on the fringes. And so what we normally do is we remove or debride and cut away all of the dead tissue, and we're pretty non-conservative. We're pretty aggressive about it, and we'll cut back down well beyond the margin of dead tissue into living tissue, so that we have cut away everything that is infected and dying to preserve what's left. If you want to see what a lack of blood flow looks like, you probably have done this, but you can wrap a rubber band around like a finger and you can see it change in color. And as you see it change in color, you could be thinking of ways that you could describe those changes in color. And you can feel it lose heat. You can feel it lose circulation, and you can start to see it change from white to blue to purple. And at that point, you really ought to be removing that constriction and that rubber band and allowing it to flush back up again. Okay, so that's our intro to pathology terms. Start playing around with some of your other terms like leuco, which means white, and some of your other skin layer terms, and start mixing and matching these colors and suffixes to help describe things that may go wrong with skin. And we'll add on some specific terms on lesions when we come back for the next lesson.